Good morning, Flagler County. This is Danielle Anderson, your host of Lifeline, the radio show connecting you to positivity in our community. And we have Dr. Earl Pescatori in the studio. Good morning, Dr. P. Is that okay?
It's fine. That's what most of my staff calls me.
Do they?
Yeah.
All right, good. I don't need a job, but I feel like we're after the early conversation, I feel like we're kind of cool like that. So for folks who haven't met you yet, tell them a little bit about who you are and what you do.
I am a urogynecologist, which is a combination or a subspecialty of an OBGYN, and my practice is focused on pelvic prolapse, urinary incontinence, and fecal incontinence.
And so for people, I mean, if you're breaking that down, I know it's a little early and some people are having breakfast, but, what are some of the things that someone might come to see you for?
Pelvic pressure, sense that things are falling down into the vaginal vault, leaking urine, like with cough or sneeze or lifting, but also urinary urgency and frequency, and the same problems with their bowels.
Okay, it's kind of weird, but urinary frequency, is that considered like a urinary tract infection?
Not necessarily, but that could be a symptom of a urinary tract infection.
So how would someone know the difference?
The simplest way is with a urine analysis.
And if not, then what would you do?
Then we start to explore what's going on and talk about what are you eating, what are you drinking, how often are you going to the bathroom, are you wearing pads, those types of questions. Just try to outline it and qualify it a little bit.
And is that something that happens to men and women or just women?
It happens to both. It's more common in women, but it does happen quite a bit to men also.
That's interesting. So when people think of OBGYN, they always think of seeing women, but do you see men for issues sort of like that too?
No, I don't. No, I strictly see women.
Awesome. All right. So how did you get started in this field?
Started off going to medical school and then doing
Oh, wait,
residency.
we have to go further back. Like, where did you come from?
I was born and raised in Fort Lauderdale.
Okay, so you really are Florida.
Right, from Florida.
Uh-huh.
Went to Cooper City High. Then I went to Iowa for college. I went to William Penn University, which is a small Quaker liberal arts school kind of in the middle of nowhere.
Did you know you were going to be a doctor at that point?
I was a pre-med major, so yeah.
Okay.
But I ended up with a double major and a double minor. I sort of didn't know what I really wanted to do.
So what else did you study?
Well, I had a major in biology and in applied computer science, and then I had minors in mathematics and chemistry.
Okay, I really thought it was going to be literature, English, something along those lines.
Well, I had enough credits to get a minor in music, but I didn't have the theory classes. It was just all the performance classes.
Very cool. And so from there you went to?
I went back home to what's now called Nova Southeastern University.
Okay. And then where did you get started?
Then I did my internship at Naval Hospital Oakland in Oakland, California.
Did you join the Navy?
Yeah, I was in the Navy, yep.
For how long? My dad's in Air Force, so I'm an Air Force brat.
I was on active duty for about 8 years, reserves, and then independent ready reserve. It was total about 16 years.
Nice. So it always seems like, I don't know if you've noticed this, but it seems like doctors who've been in the military, they seem to have like a different kind of experience versus civilian doctors. Do you find that to be true?
I'm not sure. I mean, the biggest thing about being in the military is you were taught to do more with less. You never really had the right stuff to do the job. So
that makes a difference.
Yeah.
All right. And so like when you got out of school, did you know that this was the field that you wanted to go into, the specialty?
Not the subspecialty necessarily. I really liked at the time obstetrics and gynecology because back then gynecologists were the only ones that really did true minimally invasive surgery. Things like laparoscopic gallbladders and that kind of stuff didn't exist back then. But gynecologists did do laparoscopy, and I really liked that. And so that's kind of how I moved into more of the surgical specialty of obstetrics and gynecology.
So you like the little, so that goes with your computer science and your mathematics and the technology part of you.
Probably, yeah. Yeah, that's probably, I mean, most of the surgery I do now is the robotic assisted stuff. So yeah, I mean, I use the Da Vinci robot to do probably 70% of most of my surgeries. So.
Wow. So when you started, the Da Vinci wasn't around, was it?
Well, technically it was. It was across the bay in the San Francisco side of the bay being developed at DARPA, which is the defense research arm. They originally developed the Da Vinci robot to be in a tracked vehicle that would have been moved to the front of a military conflict zone, and the surgeons would be in the rear so that you could put people into the box into an OR and operate on them from far away. That was the original concept for the robot,
That's incredible.
and then it eventually got bought out by Intuitive bought the technology, and they're in the Bay Area. That's where they started.
So did you say, I just know I want to use this robot, and that's
No, when they first showed me the robot, I thought it was dumb. I really thought,
really?
yeah, I thought, most of what you're doing with this, I'm already doing, or somebody else is already doing that with, standard laparoscopy. Why do I want to use this? Um, and I sort of got recruited into it and thought, well, this is kind of interesting, at least from a technology standpoint. But the more you use it, the more you realize how helpful and effective it is.
So do you feel like it kind of creates a better patient outcome?
That's hard to prove. I don't know that anybody's truly proven that in a well-rounded research way. It has helped surgeons do a better surgery, probably. You have a little better control, I think, with that than you do with straight sticks, because the big difference between straight stick laparoscopy or conventional laparoscopy and the robot is you get your wrist back. The robot has wristed instruments, so you can kind of go around a corner and use instruments much like you did with your own hands. So I think you get a little bit more meticulous surgery. You can also alter the dynamics of the instruments. You can change the ratios and make it more precise. And the camera technology has always been really outstanding. So you get a 3D high def visualization versus traditional laparoscopy, which is just 2D. So it's a little bit more immersive. The ergonomics are really nice, so that's helpful for old guys like me with disc disease in your neck and that kind of stuff, because you really have a nice neutral positioning, and it's just a more comfortable surgery to perform as a surgeon compared to other things.
So you've really come to like it.
Oh yeah, very much.
That's awesome. And how do you feel like it's changed over the years? Do you feel like there's
Oh,
new things?
yeah, the robots have been updated multiple times. Let's see, there was the S, there was the SI, there was the X, XI, and now the 5. So all those generations change a little bit. The ergonomics improve, the instrumentation improves, the integration of other instruments improves, the insufflators that we use, which helps blow the tummy up so that we can see, that's all improved. All that technology has come a long way. So it's constant improvement, where the visualization now is better than when I have to open someone. I can see better with the robot than I can usually with an open case.
I feel like it would just be make you feel like you're that much closer, just really in it.
Yeah, very much so, and that's actually one of the dangers of it too. You can get a little bit of tunnel vision, and you don't get sort of sometimes a global view. So that's one of the things you have to think about and pay attention to and learn to avoid.
That's all. Is there anything that the robot actually needs that you would like to see that's not on there yet?
Well, the newest generation is giving a little bit of change in that you're beginning to feel um, you're getting a little bit of return of the touch of your hands that you lost by going to the robot. Initially, you had to learn to strictly rely on your vision and on your eyes and look for visual cues. You lost all the things of tissue texture that you used to get through your hands. But the newest generation, you're starting to get some of that back. So I imagine as we continue to move forward, you'll get more and more of that touch sensation back through the robot.
So is it more like the handles, or is it like a glove?
It's you put 3 fingers in it, so your first and second digits and your thumb, and it's kind of like a scissoring type motion.
Gotcha.
But you have full wrist motion, and you can adjust wherever you want it or not don't want it. It's quite
Pretty
the thing.
awesome.
Yeah,
Pretty awesome.
the engineers are really amazing.
That's really cool. And you're on that other side using it. So how did we get you to come to Palm Coast?
Actually, several years ago, my wife and I, we were living in Iowa, and we had kind of decided that we were interested in coming back to Florida, at least for maybe like a vacation home or whatever. And we kind of looked at a bunch of different communities, and we had sort of settled on the Palm Coast area, and we were actively looking to buy just a small condo on the beach for kind of an escape thing. Um, and then COVID hit, and that sort of messed all that up. But fast forward several years down the road, there was an opportunity that came here through Advent Health, and I had the opportunity to apply for the position and interview, and so we got to come here where we were very interested in being. We had come here and several times looking at real estate, on vacation kind of thing, and then we ended up moving here. So we're not on vacation. We're on vacation all the time now.
Yeah, that's like our tagline. We live
Yeah.
or you vacation.
Yeah, my wife loves that.
That's awesome. So, um, I know about a year ago when they were opening Parkway, like a few years ago, urologists and those kinds of specialties were really on our wish list. And now we've been able to bring you here. Are you seeing an influx of patients coming your way?
It's been a little bit slow at first, getting the word out, getting the understanding on what I do.
Yeah.
If you were to overlay what's called the American Uro Gyne Society um, map, membership map on the state of Florida, there's actually a big hole here. Basically, from Melbourne to Jacksonville, there was only one urogynecologist in that whole region. You'd have to go all the way into Daytona to find the next one. So when I started looking at that and looking at the opportunity that Advent Health had, you began to really understand that there was a real opening here. That it wasn't overburdened with multiple other physicians
Mm-mm.
already being here. They really there's a real need.
I know I was surprised because I think we have two here. Is that two?
There's one in Ormond Beach who's been here many years. She's very good at her job, but I'm the second person.
Yeah. So it's a rarity.
Mm-hmm. There's not that many even in the country. There's only a few hundred of us to begin with. So
No,
there's only 400 or 500 in the country.
strangely enough, my mom actually had to see a urogynecologist in Virginia, and I was like, "What is that even?" Because you never hear of that,
It's a relatively new specialty as far as boards go.
right?
The boards have been around for 12 years now. Prior to that, there were people like myself that did urogynecology, but there wasn't a board certification for it.
So, did you have to deliver babies as well?
I've delivered thousands, yeah.
Thousands.
Yeah.
So, what is your favorite part of doing what you do?
Um, you, my job is different than a lot of physicians in that I'm not saving lives and, I'm not preventing you from dying and that kind of stuff. We're not focused on it. It's not a quantity of life profession. It's a quality of life profession. So what I'm able to do is give people back their mobility, give people back their social life, give people back their hobbies. And that's very gratifying.
That's awesome. So, we're going to take a quick break and we're going to kind of dig into some of the stuff that you do, and we'll be right back. All right. Doing okay? All right. Ready? Don't go anywhere. All right. We're back with Dr. Pescatori, and we are talking urogynecology here. As I mentioned before, my mom had seen a urogynecologist for her pudendal nerve, which seemed to be kind of like a strange thing as well. But as a younger person, what are some of the reasons that they would come see you?
Younger people typically end up in my office when they've had a more difficult birth. Anybody who gets pregnant and then carries a baby to term is at increased risk for pelvic prolapse and urinary incontinence. And a fair number of women postpartum end up with some degree of urinary incontinence. As we dig into this a little bit more, it's probably more and more common than we realize. It oftentimes is transient and it improves in a matter of days or weeks, but even that person has had some kind of trauma that probably should be addressed. I've been an advocate a long time for people to have pelvic floor rehab following deliveries.
Oh, wow.
Um,
What
but
should people be doing? So, say we have a baby, um, 6 weeks, 5 weeks. When should we start doing things like that?
almost immediately, as soon as you can. I mean, if you were to go to have a knee surgery tomorrow, you'd start rehab in a couple of days, right?
Right.
We don't do that with obstetrics and vaginal delivery. And in my humble opinion, we really should. Payers don't want to pay for it. The government doesn't want to pay for it. It's not a cheap therapy. Um, but if we could help rehab that pelvic floor rather than letting the atrophy set in, letting the neurologic injuries persist over time, we would probably help prevent some of this. Not all of it, but some of it.
Are there
Yeah.
things that women could be doing at home
Well, Kegel exercises are certainly a place to start. Um, 10 squeezes twice a day. Hold the squeezes for 3 to 5 seconds. That's a great thing, and people should do that all the time. Um, but the physical therapy, the pelvic floor rehab, is very valuable. We're fortunate that we have a good person at Advent Health here who does an excellent job.
Mm.
Um, she's very well trained, and patients love her. But again, it comes back to sometimes it's the issue of payers.
Right, right. Well, also making sure that people know that that's even an option.
Sure, yeah.
Because I've never heard. I have 2 kids. I've never even heard of that.
Well, and unfortunately, if you're lucky, your doctor suggested to you in the hospital to do Kegel exercises, and that's usually all it goes to. And although that's helpful, it's probably not adequate. I mean, again, I think people would benefit from a more aggressive treatment that would help issues down the road.
So, if say you haven't done that and you're hitting your 40s, 50s, and you're starting to see what?
You may begin to have some difficulty with leaking urine. You first may notice it with laughing or coughing or other increases in intra-abdominal pressure. You may begin, sometimes people will notice it urgency and frequency. It may begin to disrupt their sleep habits. They may begin to change their social activities because of the leaking, because it's embarrassing. I know women who have come to me who will carry extra clothing in their purse, so your purse starts getting bigger because
Wow.
you're carrying stuff.
I thought it was just we had more junk in there.
Yeah. And then pads and those types of issues. I mean, it becomes quite an expense. And then the pelvic prolapse issues, progressive pressure in your pelvic area, and that can become rather dramatic over time.
So this is kind of weird, but my aunt had she had to have her bladder tucked. Is that what does that mean?
That's one of those things that I never know what it means. It can mean so many things. The patients come to me and say that, and I just request the op reports because it really could mean almost anything.
Wow. So how do you fix that when you become older?
Well, as far as prolapse goes, there's basically
Right.
3 things that you can do. The first one is you don't have to do anything. It's not cancer. It's not heart disease. Nobody dies of this. Next thing is a device called a pessary. A pessary goes inside the vagina to help hold things up, and there's lots of different shapes and sizes. It doesn't fix the prolapse, but it helps to decrease the symptoms associated with it.
Wow.
And then the last option is surgery.
So it can be fixed.
Yes.
And so, by the same token, if you're a man and you're in those age groups, what kinds of things are you experiencing?
Well, men don't have kind of the same issues. Again, I don't take care of men, but men they don't carry babies, they don't do pregnancy, and they don't push babies out of their pelvis.
Right. Well, I mean, with like weight gain and things like that, do
Those
those
things
cause
all,
kinds
yeah,
of issues?
those don't help. There's probably an underlying genetic predisposition, although we can't define that quite yet. It hasn't, the actual gene hasn't been identified. Decreasing estrogen levels probably contributes to it. Women who have certain jobs where they do a lot of repetitive heavy lifting. Smokers with chronic coughs, that's probably not helping things. When I worked in the Midwest, generally speaking, people are a little larger and there's a little bit higher incidence of smoking. So we saw a little bit more of a problem as far as, with those risk factors associated to it.
So, but you can fix most of those things. Is that right?
We can make it better. I'm not a big fan of the word fix. I mean, I can improve things, but I can't make you 20 again.
We can all dream, right?
Yeah.
So, has there ever been a case for you that's been your most challenging or your most rewarding?
I mean, there's surgeries that are challenging, but those, it's just use the techniques and minimize your risk factors, and the patients follow the post-op instructions, and things typically do pretty well.
That's awesome. What's the recovery time on something like that?
Most people feel pretty good within about 10 to 14 days.
Wow.
But the issue then becomes you got to limit your lifting, pushing, and pulling for a total of about 8 weeks after surgery.
And then once that's done, I mean, do you really have like full range of activities
Yeah, I
and
mean,
motion?
pretty much, yeah. I mean, again, depending on your age, as we get older, there probably should be a little bit of a limit on how much we're lifting and pulling and pushing anyway.
I've seen some of these ladies in Palm Coast, they can outlift me. Michelle's like, yep, I know.
For people who have been lifting their whole lives, that's probably a good idea. But for other people who are just starting out, that's probably not a good idea.
But like if you have, we have a lot of active people here,
Mm,
like pickleball,
sure.
recreation. They're
Yep.
totally fine to get back into it.
They can return to those activities. Sure.
That's amazing. So, is there any other things that you can do?
I do minimally invasive GYN surgery. I mean, hysterectomies and that kind of stuff, of course.
Okay. So, do you ever see us delivering babies here in Palm Coast?
You mean at the hospital? I've talked to the people above me about that kind of stuff, but I don't know enough yet about the numbers.
Yeah.
It's a big commitment to open a labor and delivery. It's not like it used to be. There's a fair amount of liability that comes along with it, and there's also you need basically like three legs to the stool. You need 24-hour coverage from an obstetrical standpoint. You need 24-hour coverage from an anesthesia standpoint, and you need 24-hour coverage from a pediatric standpoint.
Oh wow.
So you need all three pieces to really run a labor and delivery safely.
So
Uh,
it's not that simple. Just
it's not a simple endeavor. There's a relatively large commitment to capital as far as investing in the equipment that's needed, setting up proper rooms. You need a dedicated OR. I mean, ultrasound machines that are available 24/7 on the space, and then you have to have a crew of dedicated nurses who are specially trained. It's a specialty care unit like running an ICU. I mean, you just don't open the doors and say we're delivering babies. That doesn't work in 2025. That might have been okay in 1960, but not today.
wow. Yeah, because that's one of the questions I know our community always asks. Could we support that here? And so it's
I don't honestly know the numbers.
yeah,
So,
that's cool. So if you had to pick one specialty, of all the things that you can do, what is your favorite thing to do?
I mean, my favorite thing is probably again robotic surgery more than anything.
Is it?
Yeah.
Would it be like a hysterectomy, or would it be just
Any of those procedures where I can sit down at the robot and make things better for people.
anything with the robot? You're good to go.
Mhm.
That's awesome. So, what are some of the hobbies we might see you around town doing?
My wife and I like to hike. We have, if we ever get our stuff back from storage, we like to bike. Our bikes are we have recumbent bikes. We like those. We're in and out of the restaurants in town here.
Nice.
We've enjoyed the Portuguese restaurants quite a bit. My wife is Brazilian, so she loves those places.
Yeah, we have some very authentic restaurants
Mhm.
here.
Yeah.
That's great. So, you guys pretty happy in Palm Coast?
Oh yeah, very much.
That's great. So we can look forward to seeing you guys and keeping you here for quite some time.
That's our goal. Yeah.
I love it. So, if people want to get in touch with you or book a consultation, how can they get in touch with you?
Just call our office or talk to your primary care provider. Depending on your insurance, you may or may not need referrals.
Okay.
But we're happy to see you.
Are you here at the main campus or
I'm here-
Parkway?
I'm here at the main campus, and towards the end of this month, we're going to start seeing people up in St. Augustine.
Oh, wow. So you're really going to be working the field.
Mm-hmm. Yeah,
That's
very
great.
much so.
Well, thank you, Doctor. We appreciate you coming in.
Oh, I appreciate being here. Thank you for
Yeah.
your time.
Absolutely. So we do want to thank WNZF News Radio, Flagler News Weekly, the Vigilante Philanthropists, Massage by Natalie and Company, and Benjamin.